Thank you, and to be here all in this number. So we have the pleasure to announce that we've reached an agreement in principle yesterday, and we thought that it was important that we tell the population and all the people that were there to support us, organization, union organization, organism, that were supporting us, our members that were there on a day-to-day basis fighting to change their working conditions, that we have reached this agreement in principle. The first thing that is important for our members that we represent is what we call the overlapping time that has been recognized to be paid. That means that as a nurse, as an LPN, or as a respiratory therapist, at the end of my shift, I have to tell my colleague what is the conditions of my patient, what is the conditions that they have, and what kind of care they have to go on with the next shift. So for people that are working 24 hours a day, 7 days a week in these kind of institutions, this will be recognized. It means an increase of 3.45% of salaries. For the other institutions that don't have the overlapping time shift, having no people to give a report, it's a 2% that will be given out to them. And it's a huge increase for them because we've been fighting for that for more than 30 years, asking the different governments to recognize that time worked is supposed to be time paid. And now we've reached this point, and it's important. Another one was the independent labor. It's been a very huge battle for us because what we're facing now on a day-to-day basis, it's people that have been put in our institution with an agency, and they are having a salary that sometimes is more than 20 to 25% of our own salaries. So our government has a commitment to reduce to 40% nationally the use of the labor, the independent labor, and that we will be at the end of that will be reached at least for the end of the collective agreement. It's 2010, 2015. The use of this labor independent is very important, that has to be reduced, because if we don't see that attached to other conditions that we've been able to reach, the increase of position, we want to have the increase of position, we have to be there to give the services, and that was one of the conditions that we had. Arrangement of work time, that was our priority. We've been facing multiple refuses by the government, by the health ministry, saying that they couldn't reach that, they couldn't do it, and they shouldn't be able to answer positively for them. So we've been able to negotiate locally and nationally way that the arrangement of work time should be done. So as an example, our people who are working full-time night shift will have the possibility to work a full-time job in 4 days, 4 nights. This is an increase. And the arrangement of work time will be possible also locally managed with the team and the employer to the day shift. That was not there in June when we had the first offer by the government. Other place that we had gained is the overtime done by our baccalaureate nurses, what we call the clinical nurses. The majority of them will have these hours recognized as as being overtime. It's not a reality today. So that's a big recognition of having these people, with the same kind of working conditions as other people. Another one was the LPNs, what we call the licensed practical nurses, the auxiliary nurses, will have a possibility to have the chief team, the title of chief team recognized. And it's important because they had to fight. They were in charge of other people, and the employer didn't want to recognize them. Now they will have this possibility. We will have an increase for the premiums of night shift, day shift, and evening shift, and critical care from 12 to 14%. It's important. They have conditions around them, but it's very important for our people that they will see that their increase of their working conditions for the premiums that they have. We had many discussions with the government. We've always been convinced that our battle was right for our people, but also for the public services in healthcare in Quebec. We have to admit that the arrival of Madame Courchaine has a big impact. She was there to say that she had the political will that we could have an agreement, and we've reached it yesterday. Was it easy? No, it wasn't easy, but it was done with respect. And on that, it's important. And for Monsieur Bolduc, what we could say is now he has a very huge message to give to the employers, that they have to be open-minded, they have to sit with our local team to have good working conditions locally with what we've been able to agree, and it will be presented to our delegation next Thursday and Friday here in Montreal.
How long do you think it's going to take for all of the nurses to be able to vote on this?
Well, what we would like to reach is, first of all, we're presenting that to our delegates. So we will recommend the agreement in principle to our delegation. They will see all the details and everything. They will vote on it. So when they will be voting on it, it's because they will be voting on recommending the agreement in principle to the members. So we will see with our bargaining team when it could be done, because we want our members to have all the details when they're going to be taking their decision. It's important. It's their own working conditions. It's the future of the healthcare public sector. So for that, we will take the time that it's necessary to reach the agreement and that our member will be satisfied with it.
Why did it take the arrival of Madame Courchaine to deblock the negotiations?
This is a very good question, but I think the political will might not be there before. Has not been there before, because she came and she was positive, saying that we will reach an agreement, that she will do everything that she has the power to do, that we will reach it. And we've been able to sense it. And that makes a big difference. If you don't have the political will, you won't reach anything. And our solutions were good. And we still believe that they were the best. We haven't reached everything that we wanted, but what we have on the table is very good for the members that we represent.
You seem very happy with the deal. What didn't you get, or what did you have to compromise on to reach this agreement?
You know, it's the bargaining table. It's like your Christmas list. You know, you ask 50 toys and you get 10 of them, but you have 10 more than you had before. So if we made the comparison for what we had as working conditions and what we will get, it's a huge increase. Just talking about the possibility of increasing the position from 5 to 7 days per week, that will be looked locally with the employers, having the recognitions for the premium for critical care. It's very important because they haven't been recognized at the level that they should have been recognized. The overlapping time. I've been a nurse for 37 years. It has never been recognized. We had to do grievances asking for overtime. Sometimes they were paying it, sometimes they were not. Now it will be done. It's 3.45% as a salary increase that our professionals will get. It's important. It's very important.
And that 3.45 is that only for the overlapping time or for the whole shift?
It's for the overlapping time. It's 15 minutes per day. But you know what? They all come 15 minutes before, and they were not paid for that. So at least now it will be recognized. It will be paid. It will be there. And I think it had to be there. And they understood that because of the work of the team.
Oui. Is it 3.5% on the entire salary, or just on, I don't know?
3.45% as an increase of salary.
Okay, so can you give us an example, like say
Okay.
a nurse, what's the top salary for a nurse?
The top salary is 35, 36? Okay, $36 an hour. Okay, an hour, not a day. But that was in my time. That was in my time when I started. Just kidding. Okay, so 3.45%, okay, as an average, depending if you have a baccalaureate degree or not a baccalaureate degree. I'm going to talk about the registered nurse with a DEG degree, okay? It's about $35 an hour. you add 3.45% increase of that, plus the increase that have been negotiated with the Common Front. The Common Front has 0.5 the first year, 1%, 1.5, up to 2% in the 5 years. But this is another increase, and it will be included in their salaries.
So some nurses could be looking at a 5, but almost a 6% increase?
At the end, well, we have to calculate it differently because it has to be done on, it's going to be included in their salaries for the one that are working on an institution that is 24 hours a day, 7 days a week, okay? So that means I'm a nurse, I work at the Jewish. I'm coming always, I've always been coming in 15 minutes before, never being paid. So these 15 minutes are going to be paid. So that makes the 3.45% that will be added to my salary as a full-time nurse.
Okay.
Is it clearer?
I think so.
Sur tout le temps de travail,
3.45%.
Sur le salaire.
C'est sur le salaire. It's on the salaries. Yeah.
Yeah.